Welcome to itdesk.tv. Welcome to itdesk.tv. I know we've been out for a while. I know you guys have sent in a lot of stuff, but we'll get right back on it. So what we're talking about today is, we've often talked about medical software and how important it is to move in that direction. And I've showed you on the TopazEMR.com website where a doctor can get a HIPAA compliant application. All they have to do is pay, for example, for one user's license, and you'll get the entire software for a year. One user's license, you'll get it for a year. That's a real thing, so check that out. But today I have an application for you for the nurses. This is a free one. I want you to tell this to any nurse that operates at any school. This is really for school nurses, any nurse whatsoever, and this is what you do to get it. Follow now. So you'll go to the TopazEMR.com website. You'll type TopazEMR.com. You'll see something saying Access Outbreaker. You're going to go ahead and you're going to click that. You'll get a screen coming up like this talking about the Outbreaker electronic medical records. It's actually a light version of the Topaz EMR, but it's labeled Outbreaker. You're going to register on it. Just register. Put the facility name that you're operating. And so if you're at a school, Manning School, Broome, Godfrey Stewart, whatever, you put it in there, put the phone number. And this is important because there is a verification process that takes place, so you have to do it. Without the verification, you can't get it. There is regulations and all these things that guides medical software. So without you putting in that stuff and it being verified, can't let you on the platform. I'm sure you understand. All right. So let's say afterwards you go back and you get registered. Now you will see buttons like these on there. You can search for patients. You can add patients. Persons can self-register to your portal. So let's say you're dealing with students, you can go on there, set them up, and so forth. So let's see what it would look like to register a person. So you fill in all the details for the person, passport, they have it, first name, last name. You put as much information as you can to identify who the person is. When you're done identifying the person, you can always search for them whenever they come to see you, all right? So I'm going to go in and I'm going to search for anyone with that name. So you choose the person. So here it is. I'm not going to put them on any test list. I'm just going to do a medical record. And this is what nurses at schools do. They do medical records for students who have issues, but they can't go back and find stuff easily in order to know what was done before. As soon as I go on this patient, I already see that they've been here in 2023, in 2022, twice. So I probably want to look to see what was these visits about before you treat them if they're having issues, all right? They have chief complaint with a lot of options. It's all check boxes. History of present illness, medication review systems. These are medical terms. Nurses know these, doctors know these, and you can do all this stuff. It's very, very simple. Let's say there's a new one that you'd like to add. So you add the clinical. Now it's added with the date and time. You can select it, and as soon as you're able to select it, you can go and start editing it. So you can go in there now. This person is suffering from headache, weakness, they're probably having a cough, and they're having a fever. And you just follow the check boxes. And if you need to type something, they could say for the past 2 days type thing. So you put whatever you need and just go down and you store the information for the student in here. All right, it's a lot of stuff that you can use. You don't have to use it all. Use what you need, and that's it. Now you'll realize for this record that I created today, I can edit the record, and you're able to edit the record during the time. But when the day passes and it moves on, there's no way to edit the record again. So it maintains the integrity of the data. You can't go back and change it. You have to, but you can edit the one that you're working on today, right? Because you might not have enough time to finish the record, but you have a full day to finish that record, and then you can move on. This person, you probably want to check if they have any past medical history, if you're going to give them any medication or anything like that. So you hit the edit button here, so you could have it updated, but you see that this person has asthma, chest pain, respiratory problems, things like those, whatever they have. And you scroll down, you can have a look at it. So if a nurse was there before or another doctor was dealing with this person, you can see what was done and what they're allergic to already. For example, penicillin, this person is allergic to it, so you wouldn't want to give that to them. All right. There's some good stuff. And that's the Topaz EMR Outbreaker. And how do you get this again? You go to the topazemr.com website and you just hit Access Outbreaker, self-register on there, put your facility. It's 100% free. You can start using this today. itdesk.tv, unlocking doors.